Hello, everybody, and welcome to Ask Dan. Tonight, we've got a really good, powerful show in terms of a broadcast. I expect to have a couple lieutenant governors from around the country. I know we have Lieutenant Governor Bethany Long from Delaware, and looking forward to having Lieutenant Governor Garlin Gilchrist join us. But as always, I just wanted to open up the discussion about you saying how important it is that we keep our health in the state of Rhode Island. We're involved in a reopening strategy as it started over the weekend, and we're going to talk about that for sure. But we got to make sure that we follow the governor's office directions along with the Department of Health directions and Dr. Scott to make sure that we're staying safe. We're going to reopen the economy. We know the virus is going to be with us, and we're going to have to be as flexibly as we can to reopen in that economy. So I want to welcome everybody here tonight. If you have any questions, rather the issues that we're talking about, or any questions you have in general about the COVID-19 issues, or even beyond that, you certainly can contact our office, and we'll be posting up the email, or you could actually ask your questions as you're listening to the program here tonight. So with that, Ben, could we bring in Bethany Long, a Lieutenant Governor from Delaware?
Hello, how are you? Good to be with you tonight.
Oh my God! Oh my God! And Garlin came in too.
He's here.
How y'all doing?
Thank you so much for both being here with me. I know we were on a call a few weeks back as we're touching base as lieutenant governors, and one of the things that you were talking about, which I want to get to, is like the reopening strategy in our states. But initially, I just want to just introduce to the audience my friends here from Delaware and from Michigan, and they're great leaders in their states, and they're doing a great deal of work on not only the crisis that we're going through right now, but so Bethany Long, she's been elected, I think it was 2016, started in 2017, right?
Yes.
And
governor, yep.
Yes, and she's been very active on a number of things, a former nurse and a professor of health and nursing, right? That's what you've done as well. So
still doing that too.
Still doing it now, yeah. So welcome aboard, Bethany. Thank you so much for being here.
Absolutely. It's a pleasure. It's a pleasure to be here with you. And I'm glad that Garlin made it. And I'm glad I figured it out. I have a loaned laptop tonight. So if I'm off center, I apologize for that.
No, yeah.
Dan, to be with you, like yourself and Garlin, we've had other experiences as a state representative and a senator in Delaware for over 16 years before becoming lieutenant governor, and being a professor. It's a privilege. And I have to say a shout out to Rhode Island. They're so lucky to have your leadership. You have been very inspirational, very helpful to me. I know you were the past chair of the National Lieutenant Governor Association. I'll be taking that role on this year, and it's a pleasure to be here. And I think to get best practices, I think there's some great things Rhode Island's doing that we in Delaware can learn from, as well as Michigan. So thank you for having us this evening.
Yeah, well, thanks for being here. Now I want to introduce my good buddy here from Detroit. That's your hometown, right, Garlin?
That's right. That's right.
Yeah, and quickly becoming not only a strong leader in Michigan, but also nationally. I'm very proud when I saw you open up the first debate, and you were the welcomer for your state. Tell us a little bit about how that happened, that you were able to actually become that spokesperson for your state, in the original Democratic debates, right, back last summer.
Yeah, well, first of all, Dan, thank you so much for the invitation. And it's great to connect with all of the people participating on this in Rhode Island. And you probably got people calling in internationally because you're that kind of guy. So really, really glad to be here with you. And Bethany, certainly a pleasure. You two have been great friends and mentors to me. This is my first elected office. And so learning the practice of being a public servant and being able to call on you as friends and leaders has been really beneficial in my experience and my growth. The debate thing. So we had a debate in Detroit back when we had debates and in-person events at the end of July of last year. And it was still when we had like 1 million people running for president. So we had the debate over 2 nights. And what happened was CNN enabled us to have a local, elected official, be able to speak at the debate. And so Governor Gretchen Whitmer, who is our governor, a fantastic partner, she said, I'll speak on the first debate night, but you got to let Garlin speak on the second night. And so she was the one who, gave me that platform. And it was an amazing honor to do that in my hometown, to welcome all those people there and to really, I think, tell a little bit of why I love where I live. And I was so excited to hear what I was going to hear that night, and that folks knew that what they heard was going to be the right vision for the country. So it was a really, really tremendous honor. And I hope that we're all going to continue to work together in that spirit to and through the next election.
Yeah, well, that was great seeing you. I know that we're very proud of you representing the lieutenant governors that night. That's why I bring it up to, tonight, this is an interesting broadcast, that we're all kind of figuring out how to communicate with people. We've had a stay-at-home order that was lifted on May 8th in our state of Rhode Island. We're starting to reopen. So these type of formats are great. And then to be able to connect in and actually compare notes and share that with not only the people here in Rhode Island, but you'll be able to share this in Michigan, and Bethany will be able to share this in Delaware, as well as a discussion about things that are going on. I wanted to just kind of get your point of view on the things that, I know that there's some things that you're working on pre-COVID-19, and Bethany, I know that you've been very involved with a number of the things that have to do with health and the opioid issues, as well as I understand you're heading up the program in terms of the Census 2020 for the governor, right, Bethany?
Yes, indeed. Yes. Very busy times, as you stated, and nothing more important than it being counted. I think all of our states need to have those census forms. And we know the deadlines, thank goodness, have been extended since April 1st count day. Now they're saying it's back to Halloween, but I have a feeling it'll be pushed back a little further. And, each of us has a different role as lieutenant governor. But at the end of the day, we are, second in charge with our state. And it's imperative, Dan, that we have these kind of conversations with our small business leaders, to our educators, to our frontline health workers. And so it's a privilege to be here for us. And in my state, not only do I preside over the Senate, but also the Pardons Board, but we have those policy obligations or opportunities. And for myself, you're spot on. Like Rhode Island, you guys had a great hub spoke model for tackling the epidemic, which, by the way, this epidemic rages more than ever during the pandemic. And more individuals, you've seen the recent data reports that 75,000 Americans are expected tragically to lose their lives to mental health and substance use disorders, to suicide, as well as to overdose during this COVID crisis. So many states, including Delaware, and I'm sure in Michigan and in your state, we not only are doing projects and outreach for mental health and substance use, but to those data points, I know Michigan, Detroit's had a hot spot where we're really looking at communities of color and the disparate care issues of health equity. And don't get me started. I'm a professor in policy. So I'll quit talking right there. I'll let Lieutenant Governor Gilchrist chime.
Well, I think that gives the people that are watching here in Rhode Island a good background of why I'm so excited to have you guys here tonight, kind of share the networks that we're working in. Because boy, we got to look outside of our states, outside of our borders in many ways. Garlin talks about international. We're planning on bringing businesses through our international economic ambassador that we started, and we're going to be actually talking to businesses from Israel, Germany, Australia, and areas around the world, Hong Kong, about how they're reopening, because I think there's a lot to be learned across.
Absolutely. Yep.
Yeah, and it's interesting that you say make that point. First, I just want to say that Delaware is really lucky to have Bethany Hall on, because you have specific relevant training to this in a way that probably
well, you're an engineer there, Garlin. Come on.
It's not a hurricane or an earthquake, right? Even though I did medical school. Yeah, the public health epidemic. I teach epidemiology and infectious disease. So.
Right. I mean, who literally, there's not a better professional to be leading a statewide response. So that's amazing. Governor McKee, it's interesting that you mentioned the international and the business component. Certainly that was something, supporting entrepreneurs as an entrepreneur myself, was something that was really important to me, and sort of diversifying the set of people who saw themselves as entrepreneurs and business leaders and business owners in Michigan was really important to me. But one of the last meetings that I took before we got our first case of coronavirus here in Michigan was actually with the Consul General of Japan. And so one of the things that's been happening since then is I've had a really strong dialogue with him, and our teams have talked about what they've been seeing in terms of their response, both on the public health side and on the economic side. And it's been really helpful as we're trying to think about in Michigan what it means to have what we call a safe start, and thinking about how you can classify the risk profile of certain types of activities or job functions, and then use that then to determine what types of mitigation efforts need to be taken by employers so that their employees and team members can be safe in doing their work, and so that people who choose to patronize their businesses or consume their services are also safe too. So it's like, for example, if you're working a job where you have to share equipment or you can't help but be in close proximity, then there are like different measures you need to take to make sure that's safe, given the characteristics that we at least currently understand about how the virus spreads. So we're trying to be as conscientious about that as possible here in Michigan as we look to reopen. I mean, we put in place a timeline. Actually, all the days run together for me, unfortunately, but I think it was Monday. We enabled for, with the appropriate measures taken, manufacturing to begin the path towards restarting in Michigan, which is super important for our economy. Like, in case you haven't heard, like, we build a lot of cars in Michigan and the whole automotive supply chain. And so thinking about how that can be done responsibly with labor involved and represented with the United Auto Workers, like making sure again that people are still respected and protected at work as we think about how it needs to start. And this is so important because like our people are our economy. Like I actually don't like how sometimes this is positioned as a choice between people and public health. Like, healthy people are our economy. People's confidence in their health when they leave their home and they go into a business, that's how our economy works, literally. Like, it doesn't matter if you open your restaurant if everybody's scared to go to restaurants. So we have to have in place the public health infrastructure to support people when they, if and when they get sick. The safety net for people when they're at work, or if they feel sick at work and are not scared and intimidated to have to go to work anyway. We have to have all those things in place in order to safely start and define what our stasis or what our new or to be determined normal will be.
Yeah, and that's what I wanted to talk about a little bit, because I know both of you have got your hand on the pulse in your states about the reopening strategy. And we had a stay-at-home order that went through May 8th, and then May 9th we started an opening on a phase 1, phase 2, phase 3 strategy, and we're starting to open up some of the retail, starting to open up some of the restaurants, potentially even some outdoor dining strategies, but yet I've been advocating as a small business person myself is that we need to really recognize how much anxiety and stress is on these small businesses that are seeing no revenue and still got the overhead. Some of them are getting helped with the federal programs, but many are not. And so I've been really advocating, hey, let's find the ways that we can be flexible, still stay safe, but be flexible to allow these businesses to open up. Where are you, Bethany, right now in terms of your reopening strategy?
Well, I feel bad. Garlin's up in the north middle of the United States. We on the East Coast, have that pack where our governors, Rhode Island, Connecticut, New York, New Jersey, Delaware, and our sister state's not part of it, but Governor Hogan in Maryland. Delaware took a very early on, very proactive public health stance, but kept some measures in place to allow for, curbside delivery and things with restaurants. We are initially were closed through May 15th. That has been extended to June 1. However, during that time, we have put phase and interims in, just like you are. Phase 1 will start June 1st, while phase 2, phase 3. Some states are calling it red, yellow, green, whatever the color. But in Delaware, we allowed for things to keep the restaurants carry out and things, which of course was tough, but we had a pretty extensive essential list. And in Delaware, because our governor, myself, and others are into physical fitness and other activities, we kept our beaches open, not for sunbathing, but, distance, physical activity, surf fishing, those kinds of activities. So for us, our phasing is a little bit different, but public health is the key. And Garlin, you said it spot on. It's great that you and Dan both have those awesome connections internationally. Our governor and I always say you have to have a healthy community to have a healthy economy. And it gets back to the people component. And I think that is what makes us great. And I have to say a shout out to our governors and to my colleagues and lieutenant governors. I think we have stepped up. There has not been a national uniformity, national direction as much. And so, Dan, hats off to you. I have to give a shout out to those individuals listening in your state. You having been a mayor and the municipal election issues and the programs you've done from your municipal days. carried over and taught me lessons in Delaware. We have very much depended upon our local government and our county governance to be partners along with our hospital systems. Government will not do this alone. So we in Delaware have a phased approach. Last thing I'll say so that Garlin can talk is we did do and have done, and I would encourage those there, which I think you're doing by having us tonight, are virtual town halls. I hosted 11 town halls virtually, and they were done in 8 days. They were done with small businesses, and they were also done with the public. So you can imagine the thousands of views, but very important to hear from the individuals. And we have made changes based upon that. And I'll stop talking and give later.
Well, I know that I've been saying that I've been taking more meetings than I normally do because there's no travel time. So I don't have to travel. The meetings, boom, 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 6, 7, 8, 9, whatever they are. Tell us, but I wanted to, before, and one of the things I wanted to talk about, so in Rhode Island, we are having an issue with high infection rates in our Hispanic community, and then also in our minority communities. I know, Garlin, you're championing that in your state. I'd like to have you share actually the backside of this show. We're going to have some of our Black community leaders on to talk specifically about that. I know they're listening in right now to both of us, all three of us, but that's one of the areas that we're trying to figure out. And we know that, that certain income areas, certain type of people that are impacted economically are less likely to be able to work from home like I am right now. But please.
Yeah, Dan. Yeah, this is real. I mean, the way that the pandemic is impacting different communities is, in some ways, shining a light on something that has been present for a long time, as far as just differentiated impacts of whether it's when it comes to health outcomes or educational outcomes or socioeconomic outcomes, business success, these sorts of things. And so, unfortunately, I can't say that it's wholly surprising that we've seen higher mortality rates of people of color from this virus. In Michigan, we made the choice in the beginning to collect racial and ethnic data when it comes to coronavirus test results and COVID-19 deaths and report those out. And that enabled us to be able to observe whether these disparities did persist. And sure enough, in Michigan, Black people make up 14% of the population, but we've accounted for 33% of the infections and 41% of the deaths. And I am speaking with you from my home here in my hometown, Detroit, as you hear my children coming into the room.
Yes.
And, so we decided that we would take a full-throated. Yeah, those are my 6-year-old
Those are
twins.
Twins in the background, and congratulations on Ruby, your newborn too.
And so we thought that we needed to take a statewide approach to look at this because, while Detroit has been the epicenter in our state, we have a very robust, migrant worker community on the west side of our state, which is primarily Latino folks. We have in the northern parts of our state, we have 12 tribal nations that cover actually most of the state of Michigan, and want to make sure that we were had that voice at the table as part of this task force that's looking to do two things at once. One, we're looking to recommend interventions that we can take now because people are getting sick right now. People are dying right now. I mean, at 4:30 today, I had a cousin pass away. It's the 20th person in my life who's passed away from COVID-19. It's real. And so what can we do to make sure that we're helping people address the fact that isolation is very difficult for people who are low income and live in a small place or have a lot of people in their home and you have one bedroom and one bathroom, you can't isolate and you share a bathroom. So we're putting in place isolation infrastructure for low income people across the state, ensuring that there's testing accessibility because as Governor Hall long said, the lack of a national strategy when it came to testing capacity meant that there had to be choice, medical professionals had to choose who got a test and who didn't in Michigan. That introduced the opportunity for implicit or explicit medical bias in those choices. And so our chief medical executive, Dr. Jonay Caldoun, through the task force work, wrote a letter to every medical provider to just have people just recognize and be mindful that bias could have been present, which research has shown is one effective way to help to mitigate the impact of that bias. And then the third thing is on testing accessibility. As we ramp up our testing capacity in Michigan, we're working to make sure that we can actually get testing to the people who need it most. So we're talking about nursing homes, we're talking about prisons, homeless shelters, and the zip codes that we know are hardest hit. So we literally have a pilot program with Ford Motor Company and Wayne State University in Detroit, where they have a specially outfitted van that has 10 people in it and they go and drive the van to a place, and you can test like thousands of people. And so we're taking that literally to where the tests need to be, and that's going to help us test vulnerable populations. And that testing accessibility matters because that's the gateway to actually getting treated. So that's how we're trying to look at that, and that's part of the infrastructure that needs to be in place for us to open up testing, contact tracing, isolation capacity. With those things, we can then combine that with the risk profiling of different job functions and service consumption functions to be able to think about how we can define our safe start. So that's kind of how we're thinking about it. It's all connected.
It's all connected, Garlin. You're absolutely right, and we're going to be talking about that a little later on in the show. And we've had, and when we visited Delaware for our meeting for the NLGA and DLGA a year ago, Rosa, I think Bethany met Rosa in our office. She's been doing a Spanish translation from our office on every press conference that the governor's had into this community. And I've had guests on these shows that I says, well, I introduce them and they speak Spanish. And I says, well, did everybody understand what they just said? And of course they didn't. And so there's things that we have to come to terms with. And hopefully we're going to be able to really recognize why on the what long term we have to do to correct the issues that you just talked about, those disparities. That I've been very involved with education work. I can't wait to get back into that discussion, because I think a lot of that is about education, and a lot of the earning power that comes as a direct result of education. And we really need to do some things on that. But Dan,
let me say one more thing about that on the disparities side. And because I think, some of the interventions that folks are going to identify, we have, infectious disease experts and epidemiologists and medical doctors and faith leaders and all those kind of people on the task force. Like, they're going to recommend stuff that's just good policy that we should do anyway. Right. And so I think that's true for a lot of the policy responses that we're thinking about. A lot of the small business supports, the expansion of the safety net. Like, I think once we are on whatever the other side of this pandemic looks like, we're going to have identified a lot of policy interventions that just make sense, and that we need to think about what it means to codify those longer term. Maybe there's a slightly more sustainable version that's not the emergency version, but I think that's going to be a real important conversation. I think this has expanded our policy imagination in a way that's important and positive. And so I hope that we continue to build our here.
Bethany, are you seeing certain communities impacted more, as we just discussed with the Hispanic community in our state, the Black community in Garlin State?
Yeah, absolutely. And today I was on a call with our governor. I have a weekly call with faith-based leaders. Delaware's like Rhode Island. I'm not like Michigan, very small. And we're able to do this with the Latino community leaders. We have also our Black American leaders. We have our African American leaders. I have Creole, Haitian speaking. I have Spanish speaking. My office as lieutenant governor is coordinating that. We don't have an official task force, but I've been trying to facilitate the work of our Dr. Walker, who is herself an African American female physician who oversees our health department in the state. And the issue is that we've got to get the testing, we've got to have the contact tracing. But again, this is a wonderful window of opportunity, Dan, and you've done that. You've seen it in your vision that we can, as Garlin indicates, see this as an opportunity for long-term health equity and social determinant changes, which affects all of your business leaders who are listening, your African-American leaders who are listening. This makes Rhode Island stronger. This will make Delaware, this will make Michigan stronger, the more that we are able to take advantage of this window of opportunity. And again, with the testing, it is tragic when it is due to the fact that people don't have health access, they don't have the transportation, they don't have housing. In Delaware, we are home to, as you learned when you visited last year, agriculture's #1 poultry industry, the chicken. And we have had a major outbreak at our poultry plant with our workers. And it's not due to the plant. The plant is great on staying on top. It's when the individuals go home, the crowded housing, not having the place to socially isolate. So this opens that window of opportunity for all of us to look at those things that make our community stronger and healthier in the long run: the housing, the transportation, and those justice issues that I know we look to. And it makes for business to have better employees and better customer base.
Yeah, and I've been saying similar things in terms of look at especially when any particular community has a disproportionate infection rates, that impacts the ability for us to reopen our economy. So everybody has an interest in figuring it out, not only because it's important to do it for the people themselves, but also the overall, their own personal life, their own personal families are being impacted this way. So it just gives you more of a reason to really push hard for, to make sure that, that there is a level playing field on these situations. And I followed both what Garlin's doing in Michigan, and I thank you for that. And I have read about your personal losses and your family's, connections, your extended family. So condolences there. Those are real people in your lives. And we know that to be true. But I think that you're stepping up as a leader to talk about that. And I think you can be a real strong voice for that, Garlin.
Well, I think it is important that, again, the numbers are terrifying when we talk about the number of people who have contracted the virus across the country and people who passed away. And behind each one of those numbers is an actual person with people who love them. And so I've been sharing that just to let folks know that I don't think that our pandemic response is an intellectual exercise. I also, make it real that it's not a political exercise. This is a public health response that we need to be thinking about, and that's been something, as we've seen sort of evolving politicization of the pandemic response in our respective states as well as nationally, and I think we need to just always be grounded in people, and so that's why I share that, because these are the people who are our neighbors. These are the people who create the businesses that we love in our communities and we want to support. These are the people who do the jobs that some of us thought were invisible, or so many people don't show enough gratitude for. Like, how many times have you thanked your bus driver? But you should thank them, because right now they are risking their lives to provide public transportation to people who otherwise would not be able to go and get their groceries or get their prescription drugs. And so these are times right now for gratitude, and certainly one of the ways I've been spending my time, it has been doing calls with all those different frontline workers, with our nurses, our nurse practitioners. I did one with the administrative staff who are working at hospital, because they're still doing paperwork, but that stuff is still important and has to be done to make sure that we have the information and they're communicating with your doctor. That's all of this matters. And I hope that I think that, this once in 100 year pandemic is going to, I think, lead to a revolution of gratitude in our society, where we're going to think about, again, we're going to value life in this much more precious way, because people are losing people. And when you think about mortality, a lot of people respond with gratitude. And I think that's going to be one of the silver linings that comes from this.
Well, thanks for sharing that, Garlin. And I know it comes from a personal place, and that's really important that we are attaching, real personal stories to this problem, because as I'm saying, people, I've kind of I've been on many calls like you have, and different organizations, and invariably I'm hearing, some of the theories that that we're really not dealing with a health crisis. But I remind them, look, at all our public schools are closed, all our universities are closed. The NBA's not playing. I like watching them play a little basketball, Garlin, and they're not functioning. This is an extraordinary time frame, and as you said before, very correctly, this is not political. If you're getting your news from either side, to the left or the right, on certain networks that are really politicized networks, go get your information from real valid type of sources, and Bethany can speak to that very clearly, because as you mentioned, Garlin, she's one of those sources that has the training there.
Yeah, and been on the streets. And I know as we round out our half hour with you, I know it's something that's very, personal and impactful. I happen to be in a state where we have someone running for president who is trapped in his or her basement at the moment, so to say. And I bring that topic up because it is about people who are in isolation. We, again, are talking about the loss of loved ones, and Garlin, so sorry about your loss. Rhode Island has been a leader in this state and this country, to us in the mental health field and substance use field. Again, I want to reiterate, it is projected that 75,000 more Americans will lose their lives. I have been boots on the ground. I don't know if any of you have ever watched that show, Undercover Boss. I have been the undercover lieutenant governor. I absolutely love when I'm out, total PPE, in my white suit, look like Ghostbusters. You don't see anything but the whites of my eyes. And I'm helping to do screening, COVID screening on the most vulnerable populations, our chronic, mentally ill, homeless individuals, many whom are veterans. And people are hurt. They're suffering. And we have moms with 4 or 5 kids in hotel rooms. We're trying to isolate. We're keeping people protected. But these are real lives. These are real workers. These are individuals who were in our restaurants, who were doing work in other essential and non-essential places. So it's real. And I'm just thrilled to have had this opportunity tonight, whether I'm the undercover lieutenant governor nurse or whether the policymaker. But I think all of us agree with what you said, Garlin and Dan. I'm so glad that you had us to show that across this country, we have individuals who are in it for the right reasons, who are trying to come up with best practices. And so I'm watching what you're doing. I know you're watching some of Delaware's programs where we're giving grants and loans to small business, and we're working with folks in colleges. So I just want to say thank you for having me this evening. And I hope that we will continue to chat. I know we won't get to see each other live this year at our annual conference, but we'll make it through this. Thank goodness. Hopefully this will be it for the next 100 years. But again, Philadelphia was the home to the last Spanish flu, one of the worst in the country. My great grandmother was 16 and worked on the streets of Philadelphia with that flu. So I hope that we don't see another one of these for 100 years.
I'm with you. We don't want to go through this again. And we also need the shift in our thinking. I've been asking for a really big type of thinking in our state to help our small businesses in a way that, I think over relying on the federal dollars right now is not a good idea. This is going to go on for a while. And so I've been looking for those big ideas. We have been doing research in both Michigan and in Delaware about some of the loan programs. I'll share with you some of the things that I think need to be done, and states need to step up, create guarantees, make partnerships with your local banks. They let them be a social entrepreneurship program right now. They do have cash. Our businesses need cash. And so I'm really advocating for a real strong strategy that can get money into the system to help our small businesses. And you let me know if you find that, those big ideas, because I think that we need to think extraordinary right now about the economy and how we're going to allow those small businesses that provide so many jobs to survive this. So Garlin, last word to you, and then thank you so much for being here. Garlin, go ahead.
Yeah, my pleasure. I mean, I think that, good artists copy and great artists steal. So I'm taking all of your ideas, Dan, and bringing them to Michigan, because I think you've been a real champion for making sure that we can be creative with how we're supporting the smallest businesses in our communities. And so I thank you. I can't show you enough gratitude and for hosting this and allowing me to come and join you and Bethany. It's such an honor to serve alongside y'all. And I would just leave the folks who are participating in this with something I think that what's ironic about all of the social distancing that we're doing is that it actually reminds us about how connected we are, right? About how much we need each other, how much we have to support one another because we depend and rely upon one another. And so I think that, as we're coming through this, we're building really good habits to relationship management. We're checking in with people more often. I bet you call people more. Like I call my grandma even more now, right? And when we're on the other side of this, we're going to say, I love you a little more forcefully. We're going to keep that habit of checking on our people. You're going to text people more regularly and all those kinds of things. And I think that those connections and those habits of building relationship and managing those relationships, that is going to be, I think, the ultimate silver lining. And that will help people because this unprecedented emotional and mental trauma that Governor Holloway spoke about, we can help one another through that and help one another get the help that we need by remembering that we need each other to get through this. So I'm thankful for that. I appreciate all of y'all for letting me come and speak with you. And yeah, I can't wait to get to Delaware and Rhode Island because I couldn't make that meeting because my other child, my baby, was being born.
I know.
Ruby. Is it Ruby? First it's Ruby, right? Is that your daughter's name?
Ruby.
Yeah. Oh, that's
Ruby.
great.
That's right.
That's awesome. Yeah, we were wanting to be in Michigan too.
Right.
Well, I've been fortunate to visit Michigan as Lieutenant Governor and Delaware. So you are great partners, and we'll stay in touch with one another. God bless both of you.
Thanks.
God bless y'all. Take care.
Enjoy the rest of your evening. Thank you.
Well, looking at an unbelievable event, I think that in Rhode Island to know that that there's all parts of the country and we have leadership that is able to connect us in. I'm just so fortunate to have been involved with the lieutenant governors around the country and hearing the great work that they're doing. and we're sharing our ideas and we're using what each other's ideas. The Lieutenant Governor Entrepreneur Challenge that we still have open to June 10th. Kids can, students in high school can, compete for about $14,000 worth of scholarship money. That came from an idea from a lieutenant governor in Kentucky. So I was very happy that my friends were able to join me, and I appreciate their time very much. They're as busy as we all are, but I hope that you enjoyed that. And if you have any questions, for instance, you may have family in Michigan, or you may have family in Delaware. If you have any questions that you want me to kind of pass on to the both lieutenant governors, let me know. I'd be happy to do it. Okay, second part of the show, Ben. How we doing? Do we have any questions out there that we should be discussing, or any information, Ben, or we go right to the next segment?
We're good. I just want to tell everybody, for the people that sent in questions about not getting their callback from the Department of Labor and Training or anything like that, I want to direct you to, on the page that you're watching this on, you can find the small business virtual town halls. And in that, Cheyenne, who works in the Lieutenant Governor's office, gives you the email addresses and the contact information for the Department of Labor and Training and Director Matt Weldon, who can answer those questions for you. And it's just, they have to go individually to every single person and figure out what's going on with every single person. So I know it's hard, but the contact information is right there. So that's really it for the questions.
Great. Well, let's bring on our next guest. It's a very important topic, and I think that Garlin Gilchrist, the Lieutenant Governor from Michigan, spoke to the issues that we want to be talking about. We want to make sure that everybody gets a voice out there, and these gentlemen here are going to be able to introduce yourselves and let us know. We want to talk about many things with Mark and Brother Justice and the Black Lives Matter issue. I have a saying on the Black Lives Matter issue. It's a full sentence.
It is.
It's a full sentence. So I asked people, all right, do you agree or do you disagree that Black Lives Matter? No, it's a yes or no answer. Okay, and then they say yes. I said, well, good. Then let's move on. Let's understand that that's the truth. So, anyways, I want to welcome both of you here tonight. I think that there's a very important messages that you have to deliver and to provide a voice to every community in the state. My theme is the number 39. We have 39 cities and towns in the state of Rhode Island, and every community is important. Everybody lives in those communities. It's important, and the communities that make up the communities are important. So I wanted to have you on, and we've had some discussions. I don't know if Gary's probably not showing up tonight, I guess. I'm not sure what's going on with Gary, but maybe is he backing off on this or what? What's going on?
No, I wouldn't think so. I think someone's probably just going to have to call him and find out, because I called earlier, but it went straight to a voicemail.
Yeah, well, he's a busy guy, but let's talk a little bit about your background as community leaders. And also your role in Rhode Island in general. But then I really want to get to the topic that I think you were listening in on Garlin Gilchrist's comments about the disparities and the fact that the infection rates are high and there's reasons for that. And we need to talk about short term. We also go to talk about long term. But Justin, why don't we start off with you, please?
Okay. Well, first, I just want to say good evening, Dan. Good evening, Lieutenant. For those in the audience that don't know me, I'm Justice Southridge. I've been involved with Black Lives Matter for a little bit. Me, myself, Gary Dantzler, a few other individuals. We've been working with the community in a lot of respects. We've played our part, done what we could. We've helped out with a lot of the protests, when it came to certain issues in Providence or Pawtucket, throughout the city, throughout the state. I've been involved, with a lot of families. I've helped a lot of people, just various things. I played my role as a person, as a, African American in this country, especially in the state of Rhode Island. I'm originally from Brooklyn, from New York, but I've been traveling back in here. Rhode Island's kind of like a second home to me. I kind of love the place, man. So, I've been involved with all, a lot of things, events and festivities, activities dealing with Rhode Island. As well as I'm also involved with DARE, Direct Actions for Rights and Equality, which is a nonprofit organization based over in Providence as well, South Side. And, like I said, I just, that's pretty, a lot of the, towns folks, they know who I am. They, I've just had the privilege, and I'm happy to, just be here in Rhode Island and to help out and be a part of this community.
Well, it's a pleasure having you, and a very important voice that we provide all our community and community leaders like yourself have the best interest for our whole community at large, but also we got to speak up for things that we really believe in. So I'm all in for making sure that our voices are heard, and that's the reason I asked you to be here tonight. Mark, introduce yourself a little bit. Give me a little bit of your background, and we talked on the phone the other day, and I appreciated the call we had. But kind of introduce yourself to the audience out there. Well, this program is a neat thing. You met Ben earlier, right? In terms of the person producing it. This will be seen by several thousand people, so introduce yourself a little bit, Mark, and then let's get to some of the messaging that I think that is important for us as a state. And I have my own little theories on things, but I'll share those with you as well. But go ahead, Mark.
Sure. Mark Fisher, Black Lives Matter Rhode Island. That is the organization. I'm a Rhode Islander, lifelong Rhode Islander. I moved to Massachusetts. I lived there for a little bit, but I'm back in Rhode Island. And I believe that I do have I went to North Point Bible College. I have a degree in pastoral ministry and biblical studies. And I believe that God raises up people. He raises up men and women through righteous causes. I believe that wholeheartedly. And I just wanted to thank you, Lieutenant Governor, first and foremost, for all that you do, for your faithful care, reaching out, concern, and genuine just understanding and wanting to understand. And I appreciate the Lieutenant Governor Gilchrist, Lieutenant Governor Hall Long that came on as well, and talking about legends here, 3 living legends, and we're going to continue to move the goalposts forward. And so we're talking about COVID-19 and the effects that it's having on the Black community. That's what we spoke about on the phone. And I think the 3-point, to make it pretty much simple, you spoke about education being the long-term strategy. And I think you nailed it, because that is the key. Education is power, and ultimately, and it's the answer to everything, and especially in this situation. So we want to monitor, we want to partner, and we want to educate. We want to educate through clinical guidance, and with all the knowledge and information we can gather to figure out how to slow the spread of this COVID-19 that is ravaging our country.
Yeah, and you heard Garlin Gilchrist, Lieutenant Governor from Michigan, kind of give an overview of the things that he believes that you need to do to kind of deal with the situation that you're dealing with right now. He talked about the different areas of that people are working in, and the thoughts of how to curb and reduce the infection rate. I mentioned that we've had the Hispanic community on here a few weeks back because of their high rate of infection rate. I'd love to be able to bring the Hispanic community together with the Black Lives Matter community, so that, because you're sharing something that is very similar here, and the reasons for it are shared as well. So it'd be really interesting to see whether we could actually, bring some of the communities that are impacted like this together. But give me just, and that's putting you on the spot, but I mean, there is there's some really things that the minority communities are dealing with. The COVID-19 has, highlighted them, especially in the infection rates, as Garlin said in Michigan, and their death rates as well. So tell me, proactively, the type of things that you think that could be done right now that might be able to help, deliver the message, communicate it in a way that's accepted and understood and welcomed. Tell me what you think. Tell me what we could be doing right now, because the reopening of our economy is going to depend on the infection rates and the ability to kind of control that. So maybe Justice, give me a little thought, and then Mark kind of weigh in on that. Maybe a minute or so. The things you think should be happening right now that either need to be do more of, or actually just start doing.
Well, this is really, it's really a touchy topic, because everybody's, because this is the first time that we had to take this endeavor, and, especially this opening up under these conditions. My personal opinion, I think that they should be very slow and take their time about opening up like that, because we really don't really have a grip on this situation from what I can see. We're waiting for vaccines. I'm taking all this in consideration. I'm just looking at, the timing, for the vaccines. I'm looking at the different decisions that different state officials are making in regards to when, who should open up when and where. Also, being African American in this country, I also have to look at, how that affects me and how that affects the African American populace in America. I have to look at that. And from what I'm getting back from the reports, I believe Mark, you did some research on that, Mark, right? You brought us back some statistics on those numbers from the various cities throughout the country, and it showed just basically how, the minority communities are being ravaged more so, than the rest of the population there. So, I take all this stuff in consideration. So when you ask me that, Dan, I have to say that I would like for us to take this very slow, outside of some of the other things that I'm hearing, with various little topics concerning the COVID and, people's fears and concerns about it. So, I don't want to say the wrong thing here and say, just open the gates, let everybody out, let them make their own choice. I mean, I've heard that too, and, Dan, I want to say this, right? That when this happened, and how we're allowing, how we're handling this, I wanted to say that, when this happened, there was this gray area where, when you tell people to lock in, and they have to lock down, we have to look at the psychiatric ramifications behind that. When people that, when you lock them in their homes, and some people become so frustrated. Maybe this guy might have claustrophobia or something, and he just can't stay in the house all day. Or maybe his apartment's too small for him. He needs to walk out. Maybe he needs his, counselor. Maybe he needs someone there. There are a lot of people across the country that I'm sure that are in that situation. And that's just in respect, concerning various other psychological ills or chemical imbalances people may have. So, just keeping that in mind, that is enough, to cause a person to yell out and say, look, I want to get outside. I can't take this no more.
Yeah. So reach out strategies to kind of compensate for that may not be happening, and they could be happening. But Mark, I want to go to you. Thank you, Justice.
Yes.
Mark, go to you. Give me a little bit of the background, but also I really like to kind of also dig in, as Justice just said, in terms of proactive strategies that the state could use right now. That's the reason that I feel as though that everybody needs to be listened to and really paid attention to. So give me some of your thoughts. You got a good opportunity here to kind of lay it out to me, and I can repeat these stories publicly, which I have, and then I want to get a little bit into the education stuff that I want to share with you and ask you some questions on that as well. Mark, go ahead.
Yeah, absolutely. So we are looking at some products that are still being tested and are still in the process of being approved. But as far as supplying the people with them, we want to make sure that people understand that the virus is something that is a community spread. So ultimately, what that means is that you can catch it from anywhere, any place, at any time, and not know where you caught it from. So, like Brother Justice said, we want to go slow because we want to make sure we do it once and we do it right, because we're still, just like the government and just like these private companies, trying to make sure we do it right. And so there are some hand sanitizers and disinfectants and different forms of
yeah, I want to get into that too when you get a chance. I'll talk.
Oh yeah, absolutely. and strategies we can use to prevent, because prevention obviously is the best cure. Brother Justice, he did more of the research on and addressing it now.
Well, yeah, Mark, you mentioned a very good point, and this is the type of things that I want to get to, is that access to good protective equipment, whether it's masks or whether it's hand sanitizers or whether it's sanitizing in your house, or whether it happens to be, information about the value of social distancing. I really think that that's an area that you're talking about and you're bringing up right now that is really, really critical. So I let Justice weigh in on that, and then I want to ask you, okay, how do you actually communicate in a real positive way to the people who are being infected at a disproportionate rate? And I'm not surprised that both of you have said slow the process down, because the people who are most potentially infected are most at risk. So it would make sense that they would want to have a slow process.
Yeah.
And people who are less likely to be exposed or have the risk are maybe a little bit more bolder about it.
Yeah.
And that message that both of you just delivered, I want people out there to hear that message. I want them to understand that that's coming from experience that the certain communities are having. The Hispanic community shares that with you as well. So go ahead, Justice. Just talk a little bit about the value of providing information and good protective type of equipment into the community, into the Black community, and then I want to talk to you about how you can make that happen.
Okay, thank you, Dan. Again, it's an honor to be on your show. Thank you for that. Now, also, I wanted to say that as being a Black Lives Matter member as well, I want to say that I'm also a sales rep for a company called Pegasus, right? Pegasus Pro Nanotech. And what Pegasus does, they have a solution or an application that we pretty much did the research, and we found that this is probably most effective PPE that we can actually provide to the community under the circumstances, in the meantime, in between time. Now, we have this product, and it's actually made by a company called MicroBioShield. MicroBioShield has a product. The name MicroBioShield has this product called named MicroShield, but it's a nanotechnology. It's an application that's capable, right, of preventing, infections. It pretty much, it's like a protectant. We've labeled it as a protectant, antimicrobial protectant. And what it does is pretty much it's been recognized, by the EPA, it's been recognized by the FDA approved, and the Food Quality Protection Act. Now this compound, which is called MicroShield, we have different versions now. There are different levels of this. You have a version that actually is made for hard surfaces, and when you spray this chemical, this compound, which is revolutionized through nanotechnology. This compound, you can spray it on the surface, and it lasts us for 28 to 30 days. Okay, and what it does is it prevents any bacteria, any viral, any algae, fungi, microbes, pathogens. It kills everything. Okay, now the issue, the main thing is that the process is this here. When you spray this application, right? This application, it has a mechanism that's known as mechanical kill. Now, mechanical kill is a crystalline substance that is actually 1 nanometer in size, which is actually 100 times smaller than the virus itself, which is 100 nanometers in size. Right now, what happens is that once you spray this chemical on the object, right? What happens is the chemical compound is actually strengthening the base of the object that the virus is trying to attach itself to. Okay. While it's doing that, it's creating what you call a covenant bond, an extra surface, solidifying, keeping the virus from attaching itself. And then what happens, it goes to a second stage. Next, the virus goes to a second stage by actually, it has like at see what I don't want to see. First, I just want to say,
Well,
I wanna
let
make
me
a
let me
public,
jump in. Let me jump in a little second, Justice, because you're getting a little over my head. But let me kind of
Okay, I'm sorry.
summarize it a little bit,
That's
because
what I tell them.
we're
Right.
getting
Well,
Does
you
it
know,
work?
we're very
Right, no, because I just want people to understand what it is that they have.
Yeah,
There's something available for us.
well, what I think is the message that I want to deliver is that it's very important to make sure we're following good, safe procedures in all our communities, including the
Right.
Black community. I will also say that we're very involved with a lot of the small businesses, and a number of small businesses have shifted their efforts, whether it's into sanitizers or whether it's into shields or into masks, or whatever it is. That's all really good. And any way that we can get that in there, whether it's through a sales strategy or a donation strategy, is very important. But the point that I think you're making there, which I agree with, is that one is that we really need to communicate with our communities how to stay safe.
Right,
And,
exactly.
and if you can, and if that is an effort that you're going to make, we're going to want to help you, make that happen inside the Black community and beyond. Because anywhere that we can make them safe, we're going to do better economically. We only have a few more minutes, Justin, so I want to kind of shift here a little bit to. So this education thing really has my attention. It's had my attention for the last 20 years plus. We've been involved with, I mentioned I shared with Mark at one time. I did a great deal of basketball coaching. I had a very diverse group of kids on that team. I learned a lot from them. They learned a lot from me. But one of the things I learned was when it came time for the kids to go to college, they weren't ready. And, and that really bothered me. And so that's why I started the mayoral academies in the state, because I knew that young people of all colors and all different ages and all different income levels, whether they're guys or girls, men, boys or girls, they all have a certain God-given talent, and they can learn at levels that far exceed what we're talking about right now. When we started those schools, we had people testify at joint meetings that were leaders of schools saying that they really did say that certain kids weren't going to learn at certain levels, and they were implying that kids of minority kids, kids of color coming from poor situations are not going to learn at certain levels. And it really disturbs me, quite frankly, that we keep on protecting a system that is not doing right by our kids and our families. And I just, not to put you on the spot right now, but I wanted to feed that information because there's a whole lot more that we need to do. The long-term strategies of income, stability and leveling the playing field on income levels. It's going to be all related to how well the kids are doing in school and how well they develop their skills and talent. So it really surprises me in a lot of ways that we every day we just are waiting. As Martin Luther King said, that word "wait" almost always means never. And we keep on waiting for something good to happen, and yet we're not pushing the envelope far enough, in my opinion. That you got to, Mark, respond if you like, Justice, respond if you like. But I had to keep on getting that off my chest.
Education is the key. It's and the thing about it is, if people don't understand something or they don't know, I told this to Justice, and I say this all the time. Albert Einstein once said, if you can't explain something well enough so everybody understands it, then it's not known well enough by you. So we have to understand the dynamics of everything ourselves so well and well enough that we can break it down to the lowest common denominator so everybody understands, because ignorance is bliss. People are consumed with their own lives, and understandably. And that goes for every community. So that is our mission. Our mission is to just spotlight this pandemic, which is highlighting, it's a microcosm of the socioeconomic plight of the Black community all across the United States. It's playing out like a drama with life and death consequences across the United States and colored communities. The difference is this is not Wagner or Shakespeare. This is the real thing.
It's the real thing. And I know we're going to wrap it up here. I want to get back in touch with you guys, not only to make sure we're communicating during this crisis, but I want to share with you what I know and what I know to be true. and that all young kids, they have the capacity to learn at all different levels, but we're not getting anywhere close to in certain communities. And yet, we've been able to show and prove out over 12 years of work and graduating young kids. The young lady that just graduated, she lives in Pawtucket. She's come from an immigrant family, and she just graduated this year, on a kind of a strange graduation for 2020, but she got accepted at Harvard, at Yale, and at Brown University. Beautiful. And these are young kids that we were told that can't, that don't have the capacity to learn. The year before, the top student at the Blackstone Valley Prep Merrill Academy, she came from Mexican, heritage. Family doesn't speak English. She didn't speak English when she came into 7th grade. She's just ending her first year of work up in Boston area at a university on a full scholarship. So I want to share with you what I know to be true, and see whether we can activate a little bit of, Justice used the word protest, to be out there protesting for the things you need.
Yeah.
I want to tell you that there's a big need to protest in terms of letting families know, letting parents know what's happening in their school so that they can actually push back. And I want to actually see whether we can engage you in that conversation in a real way with multiple communities in the state. So short term, let's make sure we get the message out. Long term, let's work on those solutions that you talked about. And thank you so much for sharing your thoughts tonight on a very important issue, which has to do with, it's going to delay our reopening of our economy if we have certain, communities that are disproportionately, infected, and we know the Black community and the minority communities, the Hispanic community right now. So let's do our work. Let's get it done. Okay. God bless for both of you. Thanks a lot for being here.
Thank you.
Thank you.
All right. So that was our program tonight, a broadcast. I want to make sure that, if you're listening and you want to get any information about anything relative to the virus, unemployment, the small business loans, issues that were talked about tonight in terms of ideas that can help our communities, get in touch with me at 222-2371. That's our office number. And you also can go, get in touch with us directly. I want to make sure that everybody stays safe during this time. And let's make sure we got some flexibility built into our ideas about our reopening strategies, and look forward to have you tune in on Friday on a broadcast, and then we'll be back on Tuesday and Wednesday next week with a program. If you have any ideas you would like to share personally, let me know. Happy to have you on. Good night.